Progressive Podiatry Project, here to share knowledge, insights and information for you to improve your clinical practice and, most importantly, help you help your clients. Welcome back to the Progressive Podiatry Project, the P3 podcast. As always, I'm Talysha, joined by P3 OG Jackson. How you going, mate?
Yeah, good. P3 OG, I like it. It's got a ring to it.
Yeah, just rolled off the tongue.
Yeah, no, going really good. Yeah, looking forward to jumping into a couple of topics today.
Yeah, it's good. And what I wanted to discuss today, because as a lot of you might know, there are a couple of mentorships, and Jackson and I both do individualized coaching with various people across, well, actually throughout the world, across a couple of different health disciplines and at various stages of their careers. And there's been one question that it's been quite a recurring theme that's come up recently that we've been chatting about. And it's quite a few practitioners who are starting to entertain the idea of undertaking some formalized postgraduate studies. So that's what we're going to be discussing today, the pros and cons from our perspective of engaging in postgrad study or undertaking postgrad study. So for those of you that don't know, Jackson, can you just give us a little bit of a rundown of, well, first up, when you graduated, and then how the thought process kind of came about for the current master's program that you're undertaking? Give us a bit of a rundown of what it actually is.
Yeah, of course. So I finished my podiatry study in 2017. So I was a new graduate first year out in 2018. And then it wasn't until, yes, 5 years later, roughly, 2021. 2021, I started the postgraduate degree. So as a master's of exercise science, majoring in strength and conditioning. So I'm still working my way through that. So I'm doing it part-time. So it's probably taking me sort of 4 or 5 years in the end, who knows, but we're ticking away at it. But yeah, I didn't start it until 2021. So what's that? I was 3 years out of uni, roughly, 3 to 4. So yeah, it was just a decision that I made at the time. I sort of always knew that I wanted to go in a slightly different direction or do something a little bit more specialized or a bit more niche. Well, podiatry is already niche, but something niche within podiatry, something that take my career down a slightly different route. And sort of in the background, laying dormant was this idea of doing a postgraduate degree, and it's something that I sort of thought about and been asked about in the past, and I've sort of been like, oh no, I wouldn't do that, or not yet, or definitely not, through various stages. And then I think it was just something that came about one day. I was just pondering and was just like, yeah, I'm gonna do it. I think I was just looking for something a little bit more knowledge, understanding, and yeah, wanted to direct my career down a particular pathway. So yeah, decided to bite the bullet and jump into it. What about you?
I was a few years later than you, so you were 3 years out. I graduated, so I finished studying 2007, so I was let loose on the public in 2008. And I think it was, maybe it wasn't too far. No, it was actually. So I think 2015 I completed. So I did a postgraduate certificate in clinical rehabilitation, and that was through Flinders University. And I did have the hopes of going from the postgraduate certificate into doing the master's. But then as my career's kind of evolved, what I want to do, if and when I do a master's, I think it will be quite different to that rehabilitation aspect, which that's a topic for another day. But I had one semester where I took on a full-time subject load. So I did 3 subjects in one semester whilst I was still working full-time and running the clinic. And that was not sustainable. It was 6 insane months of It hurt my brain. But luckily, the second semester, I only had one subject I had to get through, and that was part-time load, and that was significantly more sustainable. So I think that's one thing that we'll definitely talk about when we have people listening to this who are thinking about whether or not they should take on postgrad study and whether or not a full-time or a part-time caseload is achievable and sustainable if they are going to undertake that. But before we get into that realm, I do want to ask the question. So you're partway through your study and it's with a strength and conditioning focus, exercise science. Now, we do know that both you and I have our particular niche area of interest in podiatry as far as being musculoskeletal podiatry and clinical, well, not clinical, well, it is clinical, but physical rehabilitation. Now, as you've gone through your study, have you found that even though you haven't completed the degree yet, have there been different aspects of your clinical practice that you found you've been changing or you're doing differently as a result of what you've been learning whilst you've been studying?
Yes, and no as well. So not a whole lot. I think what it has mostly given me is just a lot deeper understanding of things. Being able to speak the language of sort of high performance staff, strength and conditioning coaches, be able to really understand that whole entire industry and that the whole strength and conditioning exercise science side of things. I really understand it, so I guess I feel more confident in talking to patients about that type of stuff. So when it comes to their their energy system development, their running programs, their strength programs in the gym, that they're working through with their other coaches, I can get on the same page with them really quickly. So it's given me a little bit more confidence and the ability to interact better with those sort of higher performing sort of athlete patients and their respective coaches, other clinicians that they're working with, etc. And the other thing where it has definitely influenced my practice is around testing protocols. So around measuring people's strength and speed, reactive strength, force plate use with like the Axit and the valve systems, just objective measurements. I've got a lot more understanding and appreciation for the importance of those and the importance of doing them correctly, and sort of having standardized protocols around the way that you test things, etc. So as far as sort of what I do in a consultation, as yet I'm not sure that it has actually influenced, but definitely more deeper understanding and appreciation around concepts and the ability to confidently go through with treatment protocols or exercise programs off the back of that.
Okay, and that's a good insight, but I think I would challenge you a bit if you're saying that it hasn't influenced or changed much what you're doing in the consultations, but it has improved your understanding and it sounds like your ability to develop that more collaborative approach. So that is often an integral part of our consultation. So would you say it hasn't changed sort of the framework of how you undertake your consultations, but it has changed what you do within those various elements as far as the level of communication and information that you're gathering and portraying and sharing?
Oh, definitely, 100%. My sports science and exercise science, strength and conditioning literacy, and the ability to communicate that to the people I'm working with, and whether it be patients or colleagues, definitely that has improved. Purely by being forced to read a lot more, which comes with a postgraduate degree. There's a lot more reading and writing compared to an undergraduate degree, which I've found.
Yes.
Definitely. So we can probably talk more to that as well.
Yep.
But definitely those sorts of aspects. Yeah, I've had noticed a bit of a change there, but yeah.
Yeah, okay. So maybe not so much the framework, but what's being applied within the framework. And I feel that, so if we just kind of reflect on one of the main things that we talk about, especially in the exercise therapies course, but also the plantar fasciopathy course, is where we've got our client goals and our clinical or our therapeutic goals. And often where there's a bit of a mismatch and the wheels start to fall off is where clinicians fail to link their therapeutic goals to the client goals. So essentially explaining what we're doing and why we're doing it and how that reflects what the patient's wanting to achieve. So would you say that basically from your better understanding and your ability to communicate that more with your patients, that it's improved that ability for you to link your therapeutic goals to the client goals?
Yeah, definitely. And again, particularly when it comes to things like objectively improving strength
Mm-hmm.
and improving reactive strength and improving even speed and agility, those sorts of things, being able to talk to the various tests and what we're looking to see and what their symmetry between limbs and normal sort of values for their age group, their ability, etc., and communicating where they are compared to where they need to be in relation to their goals, and yeah, trying to link all of that together. Yeah, that takes time and experience and skill as well, and I'm still working on that, but 100%, yeah, definitely improved in those areas in the last couple of years.
Excellent. And I definitely can see that, like, objectively outside looking in at even the conversations that we're having and when we're discussing case studies and just the depth of your knowledge. It's phenomenal how much it's improved. Now, there is one question I do want to pose to you that tacks on to something that you just mentioned. So doing your objective testing, your reactive strength index, looking at a lot of the other performance measures that you're undertaking. Now, with those tests, are they something that you do with most patients? So let's just say you've got a recreational runner with Achilles tendinopathy or an older client with Achilles tendinopathy or plantar fasciopathy. Do you utilize a lot of those sort of performance and functional tests with that client group, or are you speaking more so to using those tests more with those patients at the other end of the spectrum that have that performance goal or higher intensity activities in mind?
Yeah, I'd say on average, they're probably more directed towards those, more higher performing athletes, professional or otherwise, just anyone who's engaged in sport and wanting to improve, definitely more biased towards them, or more frequently using that stuff with them. However, you can still use it on anyone, and I just gauge it based on their sort of what the relevance is to their goals, what they want to achieve, what their where their current capacity is at. Like, are they able to even perform the tests?
Yep.
And doesn't make sense to perform the tests on them. Yeah, it all comes down to the context of the particular athlete or patient that you're working with. But yeah, on average, using them more with the more athletic people who want to return to sport. I think it's really important to have objective measures of where they're at with their strength, etc., so that you yourself as the practitioner and them as the athlete know where they're actually at and what they need to tick off before they can be more confident in returning to sport safely.
Yeah, and that's a fantastic point because it's essentially especially if we're dealing with unilateral injuries, when we do have those big discrepancies between the affected and unaffected limb, it really increases the risk or potential risk of re-injury occurring if we haven't returned someone to their ideal level of capacity before clearing them for return to sport.
Yeah, well,
So,
if you're not measuring, you're guessing, right? So
yeah,
that's that's
Stephen,
the that's the
that assessment. Yeah.
that's the and the AXA guys, yeah.
Yeah, and I feel it's because I don't know. Have you undertaken their training? So I did the MAT assessment courses years and years ago when they first came out, and I think they're fantastic. And there are quite a few of the tests, even like just not utilizing the AXIT system, but even just the MAT, the movement assessment technology, as far as in general musculoskeletal practice. So even for our non-performance based patients, because there are a number of tests within that are quite relevant to general MSK conditions that we see, our plantar fasciopathy, our Achilles tendinopathy, even in client groups that may not be hugely active, with the Y balance test, the lunge test. So a bit waffling on, but my question, have you undertaken either of their trainings, or are you more so utilising?
No, just utilizing what the clinic has, and I've watched all the training videos on how to set up the various tests and etc. But no, I haven't done one of their formal courses.
Yep.
But apparently they're really good from everything I hear. So and to go back to the last question you asked, do I do it on everyone? Probably more so once they're, like, say if someone comes in for an acute injury, I'm waiting until they're pain free, or they have a quiet ankle,
Mm-hmm.
quiet knee. They're relatively pain free and able to safely perform the tests and give us a reliable measure of where their strength is at. Because if they're hindered by pain, then they're not really they're not really giving their best sort of force output on these tests. So I think it's important that they're relatively pain free before you start. So I might test someone, say 6 weeks into their treatment journey, say they've had a flare up of Achilles tendinopathy. I might be calming stuff down for that first sort of 6 weeks, and then I'll test, and then I'll be like, all right, so we've done really well at this point to reduce our symptoms, which is great. That was our initial goal. But now we're moving out of the sort of symptom reduction phase, and we're moving into your more functional rehabilitation phase now. So now is a really good time to get a baseline measure of where your strength is at. So then we can then accurately write a strength program for you that might address some of these discrepancies, and then we can remeasure in 6 to 8 weeks time, do all these functional tests again. It's a great way as well to keep people engaged in their rehab program, for those clients who are going to really benefit from a long-term strength and rehab program, and they if they drop off now and just go back to their sport, they're likely to have flare-ups in symptoms, or using the objective tests is a good way to get them on board with the program, and show them where they may still need some improvement. So it's helpful from that point of view, for outcomes as well as for business and that sort of stuff regarding sort of rebooking and cancellations in the clinic, etc.
Yeah, I would definitely agree with that. And that's where we break things down into our macro and our micro goals. So the macro goal, essentially the overarching entire treatment goal, which may be 12 months down the track. And then the micro goal is what we're looking to work towards between each phase or each consultation. So flipping back, we've dived a little deeper into the S&C world, which that's part of what the podcast is. It's a bit of a free-for-all. But I just want to take it back a little bit to some of the questions that we've had from the P3 community, as far as when we're looking pretty much at the post-grad studies. So do you feel that there are some people that you would and wouldn't advise the formalised postgraduate pathways as being a way to go to gather more clinical skills and information? So what do you feel makes it suited to some people and not others?
I think if you really want to pursue something within so whatever the postgraduate degree is, if you really want to pursue that and make that the fundamental focus of your career within podiatry going forward, then definitely that would be more appropriate. But if you're just wanting to gain a little bit of extra sort of knowledge and confidence in a particular area, that may well just be achieved by doing a online course or something similar to ours, for exercise prescription. But if you really want to sort of go to that next level in your career and direct your career down a particular pathway, I think it's probably more appropriate, which is definitely what I wanted to do. And then, you've got a lot of other things to consider as well. So when it comes to the actual commitment of doing a postgraduate degree, which you touched on before, it is a lot. It is a lot, especially when if you're working full time, if you've got kids, you've got all sorts of other commitments. It is big. So and you need to ensure that you're ready from just a life point of view to be able to fit this into your life. There's probably no perfect time. Like you're never going to be absolutely ready. But yeah, it's just a lot to consider. You have to make sure you're going to have enough time to dedicate to it.
Mhm.
And I'm still working that out as I go.
Well, to be fair, you do have a little one, so
I still just get assignments done at the last minute. So it's it's a lot. It's a big commitment. Plus, also you have to consider the financial commitment as well from like a HEX debt point of view. How that sort of weighs into it, because you're adding more money onto your HEX debt. Therefore, if you're in a position where you're looking to apply for loans, etc., you need to consider whether that's worth it at that particular point in time, what the trade-off is with that. So yeah, there's lots of variables that come into it, so important to consider.
I think they are good points, and I can mirror that, yeah, quite well, especially with the time commitment. So I found when I was, and thank goodness it was only one semester, I had to have the full-time clinic load. So that was me working full-time, running the business, and I think I was flying solo at that point. So I was working 5 days in the clinic, and then I had one day that was 100% dedicated to doing the post-grad study. And it was the most structured day out of any day in the week. It was, I can't even remember the exact times, but it was get up, breakfast, gym, walk the dogs, back, and then it was sort of 4 or 5 hours of work, break. And yeah, the rest of my days in the clinic were a lot. I reckon I had more free time the days that I was working in the clinic than I did the post-grad study days. But it's definitely, yeah, having that time commitment, because one thing that I don't know if you found this, but just the volume of work and the level of assumed knowledge that you're meant to have when you go into it. So honestly, I felt that each week with the post-grad, it was probably the equivalent of about 6 to 8 weeks worth of what we would have covered in an undergrad. Like, so just there were some weeks that it almost felt like an entire subject I was trying to sort of get through and catch up on. So it's not, so that is one thing to consider when you go from undergrad to postgrad, just the volume of information that's included week to week is often far in excess of what we're exposed to in an undergraduate level. Now, that was my experience. Did you find, or have you been finding that that's kind of the same with a few of your subjects?
Oh, 100% with every subject. So the Masters of Exercise Science degree, like students who have done a Bachelor of Exercise Science are enrolled in this degree. So I haven't done that. So I got through just with my podiatry degree and my strength and conditioning, like ASCA qualification. I was able to enroll in the post-grad. So there's a lot of assumed knowledge around exercise science that I don't have. So I've had to pick some of that up along the way as well. So there have been some subjects where I don't perform as particularly well, like from a grades point of view, compared to some others, and that's just purely off the knowledge gap from the assumed knowledge to the course content. But I'm managing to make my way through it, and also with a postgrad degree, I feel like there's more sort of onus on yourself, for more of a pressure to actually really do well, like, because there's no sort of really just scraping through. Well, I mean, you can do that, and I certainly have for one or two subjects, but you, because you're sort of choosing to do it, and you're enrolling in that subject every semester, and paying the HEX debt, with the Yeah, it's your
Inflated
choice.
price tag that comes with the masters.
Yeah, it's your choice to inflict this pain on yourself. So it's there's more, and it's usually around a topic that you really want to learn and understand more. It's not like an undergraduate where, say, through the podiatry degree, there would have been half the subjects that you don't really care about. Whereas with the postgrad degree, yeah, most of the subjects in the course are, an area that I want to actually know a lot more about. So I'm more engaged in the content and therefore want to do well. So there is a lot more discipline, and I guess you could say maturity that comes with going through a postgrad degree compared to an undergraduate. Not just in age maturity, but just the commitment to wanting to learn the stuff.
Yeah, and they're very good points, and I must agree with that. The level of self-governing that you need to do to be engaged, because a lot of the post-grad studies that we do, the vast majority of it's non-contact. So it's very different to once a week you've got your lecture that you attend uni for, or it's a Zoom lecture, and a tutorial as well. So in an undergraduate setting, that's often what we're exposed to. So you're kind of forced to show up. Well, you don't have to, but theoretically you're forced to show up a few hours a week, but in a lot of postgrad studies, that's not there. So you really do have to have that self-governing to continue to remain engaged. And it is easier if you are interested in the subject, but it also is difficult for some people that aren't so good at that self-directed approach to learning. So that's one thing to consider. And I must say, I do agree with you as well with even what I found with my clinical rehabilitation postgrad. It was a course that's designed for occupational therapists and physiotherapists, and I had to essentially plead my case to be accepted into it, because I had to essentially give evidence that I had at least some competency as far as exercise rehabilitation. So I had to go into the fact that I owned a biomechanical and musculoskeletal clinic. I did have experience in rehabilitation, and I did find that for a lot of the subjects, even those that were, so there was one subject in particular that was lower limb musculoskeletal rehab. So even with that, there was a big learning curve that I had to take. And luckily, I'd already been working and quite experienced in exercise prescription. But this was one thing that really highlighted to me, and this is quite a few years ago. So I know the university landscape and the undergraduate landscape is changing a bit as far as what's included for MSK pathology management. But back then, when I went through my undergrad, we had a couple of subjects that covered the assessment and diagnosis of musculoskeletal pathologies. And then I think maybe one lecture that covered the exercise prescription component, but there was nothing to do with how to individualize programs, how to write a program, how to select the most appropriate exercises, how to dose the exercises. It was more or less everyone gets calf raises and calf stretches, and that was essentially where it was left at. So there was a big shortfall back then as far as podiatric undergraduate study. Yes, we can assess and diagnose lower limb MSK, but then the exercise prescription and rehab part, it was a huge gap. So again, luckily I was at least somewhat caught up, but then getting really into the nitty gritty of individualized programming, and because that was one of the good things was we were able to select our research topics for our individual subjects. So I chose musculoskeletal pathologies that were relevant to my clinical practice: tib post tendon dysfunction, Achilles tendinopathy, ankle sprain injuries, post-op ankle surgery rehab. And essentially it was, most of the assignments were literature reviews and formulating a fully fledged multi-phase rehab program. So that's where a lot of my knowledge and insight improves significantly, having an understanding of the various elements that we need to consider for the different phases of rehab and how we may progress, how we may regress. So going really in depth to that. But I would say that if I didn't have the pre-existing experience in MSK rehab, it would have been a very, very difficult undertaking without that base level of knowledge just coming in from that podiatric standpoint. Again, might be slightly different today because, again, the landscape of undergraduate study is changing, but I still think that it is quite far removed from where we'd ideally like it to be. But there's so many elements that factor into what content is covered in an undergraduate degree. And there are many podiatrists so essentially, when we undertake an undergraduate degree, it's learning the foundational concepts to get through a consultation safely. And a lot of podiatrists don't want to pursue a career in MSK rehab. So there is that kind of argument against how much of it do we include in the undergraduate course, because it may be, like you and myself, more of a niche area of interest. So that's a topic for another day. And I know there's already been conversations sort of surrounding that. But long story short, I feel that what I'm resonating with what you're saying is, if you do undertake some postgrad study, one, you want to have an interest in it. And two, it does help if you do have some background knowledge, especially if it's a little bit left of center of what most postgrad podiatric pathways are.
Yeah, 100%. I probably would not recommend doing a postgrad straight out of undergrad. So yeah, I mean, I haven't done it. I'm sure people have done it and it's gone quite well for them, but my thoughts are it's probably not a great. I just wasn't in the frame of mind to do that. So, starting as a new graduate podiatrist is a big thing in and of itself. Like you're just learning at this whole new skill set and this whole new sort of challenge of being a working podiatrist, full time. So if you throw a postgrad study on top of that, you're probably not going to get the best out of both. I feel like you probably want to have some sort of grasp on your podiatry working sort of life before you then take on this whole big other aspect of your life as well. Otherwise you're just going to be not doing either very well. So
that's a really, really good point. And I do agree with that, because it's like any skill that we learn and we take on, regardless of what it is, we need to have that period of time when we're able to consolidate and apply and essentially get some level of mastery on the information that we've already learned before we take the next step and gather more information to further refine. So if you're not allowing yourself that time to consolidate and apply the information and sort of figure out what the next step may be, then you can be going a million miles an hour gathering all of this knowledge, but you may be missing the mark as far as being able to apply that to your patients. So I think that's a really, really good point. So if we could kind of summarize it, what do you feel would be some pros and cons for people considering undertaking formalized postgraduate training, and then also some pros and cons of some non-formalized, so just your general CPD for postgrad?
Okay, so definitely with a postgrad, the pros of doing a postgrad degree is you will gain a deeper understanding and knowledge around the interest area or topic that you're studying. You can sort of specialize or direct your career down that pathway with a bit more confidence within yourself, but then also a bit more authority with other professionals and your patients as well. It really does help you to level. I find as well, which we haven't touched on, your skills in reading, writing, and communicating, as well as just general organization skills and getting your shit sorted. A postgrad degree helps with that in a way, because you have to get your shit sorted. But the negatives of it are the time commitment, the financial commitment, and just the general life commitment. Like, where does it fit in with your life and your career at this point in time? It may not, or it may be a gut feel thing where you're just like, no, I think I'm ready and I really want to do it. Therefore, I'm going to enroll this year, which is pretty much what I did. So, and throughout that journey as well, like to being sort of sort of 3 years into it now, I've had some ups and downs where I'm like, nah, stuff this, I'm deferring, I'm not doing it anymore. But, or I'm going to have a semester off, or this semester I'm doing 3 subjects, I'm just going to knock it out. And then no, that was a dumb idea. Drop 2 subjects. been through all of that. So,
and I'm laughing because I remember pretty much all of these conversations that we've had through your decision-making process.
Yeah. So, a few things to consider there, as opposed to, I feel like the normal sort of CPD that you can do, such as our exercise therapies course, that's great if you just want to gain a bit more knowledge and understanding, and a little bit more confidence from a clinical point of view. That's a great place to start. But then if you really feel like you want to take that next level and direct your career down the pathway, then the post-grad is the way to go.
Yep, I agree with that. And thank you for the course plug. But that's essentially, so just talking about the course, so I'll be self-indulgent for a minute. So with both of the online courses that we have, the exercise therapies in podiatric practice, and then also the plantar fasciopathy rehab masterclass, so they're really, really clinically driven. So basically with that, it's taking a lot of the information and the theoretical stuff and showing clinicians how to apply it clinically, because that's one thing that I feel is a con that it does exist with formalized postgraduate study. And when we're talking about the formalized postgrad study in this episode, it's the structured ones. So it's not research based, it's the coursework, master's by coursework, the postgrad certificate or diploma by coursework. Now, that's where one of the cons exist, is you can still undertake that study, but you will still have to do the legwork to figure out how to apply it into your clinical practice. Whereas, so how I've written the courses that we have, it's taking that information and stepping it out how to apply it to your clinical practice. So that's one thing that I feel is a consideration for clinicians, as far as if you're looking for something to upskill you for your clinical practice, and not just talking about our courses, but other courses that exist out there. So if you're looking for something to upskill what you're doing in the clinical setting to make you a better practitioner, just because you want to serve your patients better and get better outcomes, oftentimes when you factor in what you're going to be taught, what the outcome of what you're being taught is going to be as far as improving clinical practice, the time investment, the financial investment, oftentimes CPD training might be the way to go that's more suitable to you. But then, like Jackson was saying, if you're really wanting to swing your career massively in one direction and you want to dive deep and build a really big niche for yourself, and it may be setting yourself up sort of longer term as potentially like an expert in a field, and then creating content or whatever you're doing with that. So if you have rather big aspirations as far as what you want to do with the knowledge, and it sits well outside of where a lot of the podiatric and allied health CPD courses fit, then it may be more suitable for you to consider the postgrad pathway. And then there is also the other thing, like I just mentioned with the CPD courses to consider, it is the time and the financial investment. So because it's essentially the return on investment. So it's the same as if you are looking to buy equipment in your podiatry clinic. So I've had some conversations, so this is deviating a little bit, but it is relevant, I feel. But I've had a lot of conversations with clinicians over the years when they've been looking at getting this really fantastic over-the-top gait analysis setup. So am I looking to drop sort of $12,000 to $15,000 on some gait analysis software? Yes, that might be fantastic, but if you're only having maybe 2 to 5% of your clients coming through the door that fit that niche, you have to look at how much of a return on investment are you going to get. Is that going to be something that you do get a return on your investment, and how much is that actually going to improve your patient care? If it's quite far removed, how much money you have to outlay versus how much money it will potentially generate for you and improve your income earning potential. If it's quite far removed, it may be thinking about it or needing to take a lot more consideration because you will be taking that financial hit. So that's just one thing. So if you're looking to undertake formal study just because it's an area of interest, that might be fantastic. But having that area of interest, is it worth $30,000, and how much is it going to be applicable to your clinical practice, your revenue generating potential, and for the long term? So if you have a spare 30K sitting around, this might not be relevant to you, but a lot of us don't. So it's just having that sort of financial consideration as well. So I feel like, for me, my bias is very much formalized post-grad, because I want to do more of it. Now, I know I said probably a year or two ago I wouldn't do another one, but I'm heading down that pathway because it's been a few years. So there will be more post-grad study. So I like that because it suits my learning style and where I want my career to go. It fits into that as well, but it might be different for many other clinicians out there. And then I am also pro CPD activities because that's what we create. But yeah, hopefully some pros and cons that we've discussed, and some considerations for those thinking about undertaking it. So the time investment, the financial investment, the return on investment. And also, like, it's regardless of if you do undertake formalized not formalized postgraduate education, or it's just postgraduate CPD activities, either way, the fact that you're even considering doing that, it is the hallmark of a good clinician, because we should never stop learning. As long as we are in this profession, or any profession that we're in, well, life in general, but talking in a podiatric and allied health sense, as long as we're continually motivated to learn, expand our skill set, expand our knowledge, and expand our clinical practice, I think it's a testament to a good clinician. So that's just kind of my takeaway. Do you have anything to add?
Yeah, like if you, and with the time side of things, like I sort of figured, well, in 5 years' time, or however long it takes me to do this degree, I'm going to be 5 years older anyway, whether I do or don't do it. So I could be 5 years older with a degree, or 5 years older without the degree. So once you have finished it and completed it, I'm sure it's going to be a great feeling to have got that qualification and achieved that sort of milestone, and been pretty proud of the achievement. So it's, and you can always do it part-time. So yeah, if you're thinking about it, then it might be an indication that it's time to go with it.
Yep. And yeah, I'm not far off probably signing my life away again, which is, I need to have a holiday before I do that. But hopefully this has given some of our listeners a bit more of an insight into what life in postgrad study land has been like for both Jackson and myself, how we found it's helped our clinical practice, some shortfalls, some pros, some cons. As always, we enjoy the conversations that we have with our listeners after they've listened to the podcast or watched the YouTube videos, whatever platform that you're engaging with this on. Leave a comment, like, share, and subscribe. We always appreciate it. And again, we do have our online courses available: Exercise Therapies in Podiatric Practice and the Plantar Fasciopathy Rehabilitation Masterclass, which you can find at progressivepodiatryproject.com. So that's it for this episode. It's been great, Jackson. Thank you. And we'll all catch you guys next time.